You have served as operating off of a mass healthcare company or delivering care to individuals with disabilities. You've also been involved with high growth organizations. Why lead a world of executive stuff for politics?
On healthcare, I've been very fortunate in my career, worked with some really great teams of people that help deliver better care to people. In the end of the day, it's improving people's healthcare. And what I see happening in Washington is just a continuation of an erosion of healthcare benefits. And, when you're in the healthcare field, you get to see the outcomes of, and I'm on the provider side, so I get to see the outcomes of how people improve their well-being. And when you have constraints continue to be put on the American people by this administration, I mean, I'll give you a good example if you don't mind. So at my last organization, we dealt with the intellectually and developmentally disabled population. They refer to it as the IDD group. And this population is mostly all on Medicaid. And so by reducing Medicaid benefits to some of these folks, you're really hurting people's ability to take care of themselves, not just the people that themselves need the care, but also their caregivers. I'll give you a good example. This big bad bill that was passed is going to reduce Medicaid benefits to about 1.2 million people here in Tennessee. And why that's important is because the federal government's going to stop funding, which means the state has to either make it up or they have to reduce services. And I don't see how the state's going to make up $1.2 million when they're spending $300 million on school vouchers, but that's a different story. So what it looks like they're going to do is cut services. And in the IDD community, there are home-based services that people can apply for to live a better life, live a more comfortable life. If you have a high-functioning autism, for example, you can subscribe to a service like mine that or to Station MDs that has the ability for you to call into a physician if you think you have an emergency without going to an actual emergency room. Imagine if you have cerebral palsy and you're in a wheelchair and your caregiver has to put you into a van to take you to the ER so that you can sit for 4 hours, right? It's not a good experience. With our service, they were able to contact one of our physicians. We could put eyes on, actually do a video conferencing, triage somebody, and we were keeping 90% of the population from going to the ER. Not only is it a better experience for the patient, but it's a much better experience for the caregiver, and we're reducing the cost of care. We're taking cost out of the healthcare business. And so when I see injustices like that, it's like, well, how am I going to stop? I can continue to help solve and fix problems for people, but if Washington continues to make problems for people, it's just like trying to plug a hole in a boat that's unpluggable. And so I said, you know what, it's time to do something more and to be larger than just helping people individually. It's helping people at the federal level and taking back control of our Congress.
So in programs like Social Security, Medicaid, strictly under political, having worked with clients in healthcare, individuals with disabilities, is yours brings with these vital, fragile, and expensive, affordable access for everyone. Memphis, Shelby County, County, and State.
Yeah. And, this goes back to the days of FDR and the social safety net. Social Security was brought about really so that we could protect our seniors. In the days of the Great Depression, if you were 85 years old, it would be very difficult for you to go back to work. And so in today's days, especially in today, we need to protect our seniors. We need to allow them to retire and live with dignity. Paying into Social Security was at one time one of those things where you could feel comfortable that your Social Security would be waiting for you when you retired. And that's just not the situation anymore. We've been under this constant threat of what does it look like for us to reduce benefits for Social Security? Americans are working longer now. You and I can't retire until we're almost 70. And what's it going to be in 5 years from now? In addition to that, is that money even going to be there? I would say both administrations have been kicking this problem down the road for a very long time. It's really what we need now is courage. We need people in Washington that can have the courage to go back and say, you know what, we need to fight for what we've started and ensure that our seniors are taken care of. As far as the folks that are on Medicare, I kind of look at that in the same boat. We need to expand Medicare for all. I'm a big proponent of that. Healthcare should be a right in our country. There's no reason that the richest country in the world can't afford to give healthcare to folks. Now, I'm not saying that it's got to provide, 100% of the cost of it, There's a lot of ways that we can solve this problem. We live in a capitalist society, and I suspect that you're not just going to have the health insurance companies and providers just go away. That's not real life. So we can find something in the middle. I know we just have to, once again, have the courage to be able to stand up and do that. As far as Medicaid goes, here we are helping, the most vulnerable among us. And we need to continue to do that. That's been, if I think about, my own Christian principles, it's about helping the most vulnerable. And that's one of the reasons that we started our nonprofit, to do the very same thing. And so for me, I would fight, for each one of these social services, these things that protect us as we go forward in life.
Through the Friend Foundation, you and your wife, Bethany?
Bethany. Mm-hmm.
You guys have worked directly with neighbors facing homelessness, addiction needs recovery, and re-entry from incarceration. Will that experience translate into federal policy on affordable housing, criminal justice disorder, and community revitalization?
Working in a nonprofit where you're actually speaking to real individuals with real problems gives you a very keen insight into the challenges that people face and just trying to survive every day. I guess maybe you wouldn't be surprised. It was surprising to me the level of complexity that exists among the homeless population. There are some of us in our country, in the homeless population, that simply will not be able to take care of themselves. That's just reality of it. And I see it every day. There are others that have fallen on homelessness just because of hard times. It's more what I would consider circumstantial. And these folks need not a handout, they need a hand up. And so, being able to understand the complexities of the problems that exist. I'll give you one example. We helped a woman who was homeless because she was incarcerated, came out, had a felony charge, very difficult to get a job. Didn't have her car, didn't have a job. We embraced her and tried to begin to help her remediate her life. And she wanted to be remediated. And this is I guess one of the frustrating things is people want help. People want to become better themselves. And so to help begin the process of remediating her, we don't live in a county or a city that's got public transportation. So unless you're willing to walk 4 miles to work, your job, the ability to find a job becomes much more difficult, obviously. So one of the first things we wanted to do was help her get her driver's license back. So we actually had to go to court to petition the local magistrate to give her driver's license back, which they did. We were so happy about that. We helped her get a car. We've given away about a half a dozen cars over the last 2 years through the foundation. To take that even a step further, so she has a car now. She's able to go back and get her driver's license. She has to go back and actually go to the driver's license bureau to get it, and she fails the eye exam because she doesn't have eyeglasses. Well, we have to help her get eyeglasses, but she doesn't have insurance, so we have to help her get insurance. And so the point I'm making is there are these dominoes that fall that most people don't recognize the challenges that exist with people, especially in homelessness. Same thing with addiction. You got somebody who's recovering from addiction. It's very difficult to get back out there and actually want to do it. The reason we called it the Friend Foundation is because we recognize that social interaction is so important for people, where if you've got a good friend that can check in on you, it doesn't have to be someone that runs your life, but if you feel like you've got a champion in your life, someone that's going to encourage you, and help you when they can, there's hope for tomorrow. And a lot of times it's that hope really that drives people to a better place.
You and your wife, it's at Remington Fellowship Church to offer hope and encouragement for those seeking to pay. There's no politics, right? It's really get her. How does your faith and pastoral heart guide your approach to representing a displaced Tennessee?
I run on Christian principles to help the least of these. And that's how I see it. That's how I live my life. That's not for me to press upon anybody else to live their life that way. But I will say this, there's been this rise of Christian nationalism in this country. And I think it's incumbent upon every single Christian in this nation to push back on that. I'm not saying that you can't worship how you want to worship, but don't push that on the rest of us and on the rest of the community.
Here in the Memphis, families are high cost by at his wages. How is your background in the 1880s business growth and technology to bring high-paying job, infrastructure investments, and real ability to nice design district?
Yeah. A congressperson's job is not to create jobs per se in the way that you would think of, hey, let's start a business, but it's to go find the money to help that infrastructure grow. It's to figure out how to create policy that might give tax breaks to businesses. I'll give you an example about Memphis. If you go down, the downtown area, I noticed this, my wife and I noticed this, that there are parts of the city that are bustling and there are parts of the city that seem empty to me. Storefronts that seem empty. And, when I think about in my head and the vision for Memphis, I mean, the city was once an amazing place and it still is. And the potential for it to be even more amazing exists there. The trolley doesn't run. The city doesn't have money to run a trolley. But wouldn't it be such a great thing for you to have a destination location where you could go ride a trolley? And so it would be up to me to go find some federal funding, find some grant money in order to do that. One of the things that we heard in one of these other small towns about jobs and infrastructure is that there's no way to get around. If you don't have a car, there's no public transportation. And what I told them was there was a nonprofit in a town we live in that provided public transportation. It was a trolley, not like a trolley in Memphis, but like a bus that looked like a trolley. But you could get on a bus for $1 or it was up to $5 depending on where you wanted to travel. And so there are opportunities for Congress people to go and find the money to be able to help the infrastructure and revitalize the city. You could find ways to give businesses a great tax incentive to be able to go in and refurbish one of these buildings and to open a business, to open small business. It's also about, how do you attract other businesses into a community that seems almost not barren, because it's not barren. I mean, the city is such a great city. I mean, if you haven't been to Memphis, you need to go there. It's not like what you see on TV at all. We found a place that I'm going to give a shout out to, the Crazy Gander. It's a coffee shop in the middle of town. We've met so many great people at this coffee shop, and it's a wonderful place to be. And, I see businesses like that. I see Memphis with the ability to have businesses like that can revitalize the city once again. It's just waiting. I can promise you, the city is just waiting. It's just going to take some courage from a lot of people and some help federally, I think. What else?
If that was girls. Well, I want to go back to what I've got to people. This first one, Jay's election day is right. Our early videos and not getting. What do you want to see it to yours? Well, to those who have it.
I mean, poverty does not discriminate. Hunger does not discriminate. Addiction does not discriminate. It's really for all of us to figure out how to solve those problems for each other, for one another. I think it was Dr. King that said, we may have come over here in different boats, but we're all or different ships, but we're all in the same boat at this point. And I truly believe that. And so, what I would ask the city of Memphis is, is the person that you want to represent you really going to represent you? And the only way that you're going to know that is if you get to know this person. And I've been so lucky on this campaign show where I've had conversations with real people. You might get a flyer in the mail or you might see a yard sign in somebody's yard. But until you really get to know somebody and begin to ask questions and meet them face to face, there's a lot to be said for body language and voice inflection. There's actually over 10,000 communication things that happen when you meet somebody face to face that you're not going to get on the phone or even on a video. It's, having these conversations face to face. What's interesting about this gentleman you were just talking about is that we were at a forum. He had told me this at a forum. And by the end of the forum, his demeanor had changed because he got to know me a little bit and began to understand, that my desire is really just to help people. At the end of the day, I can't make it more simple than that. I just want to help people.